In Quebec, the Breakfast Club of Canada makes sure 79,000 children every morning in more than 500 schools and community programs get a healthy, nutritious start to their day. But the club says the need is much greater and they need your help in boosting their budget to be able to help more children. Tommy Kulczyk joins us, President and CEO of the Breakfast Club of Canada. Tommy, welcome to the show.
Thank you. Good morning.
So let's take a look at the 79,000 children that are helped out every morning. Tell me about those children. How important is this?
Well, it's essential. First of all, this campaign is crucial to maintain those 565 programs. As you know, in the last few years, like most families, we're facing an economic storm. First of all, a pandemic we've never seen or seen the last time close to 100 years. The worst inflation that we've seen in the last since 1983. The price of food, the price of gas. So, what it does, one, the operation costs to put a program in place is more expensive. Two, obviously we saw an increase within the demands within the existing programs. Two, it's normal, and we're so lucky in the last 29 years to have amazing, faithful corporate partners, individual partners. And we're lucky we have all the teachers and director from schools and the volunteers, which most of them are children now. But it's normal that during the last couple of years, they had less to donate because they were facing the same crisis as every family. So it's important and crucial at this time because one thing we're so proud of the club in the last 29 years when we've put a program in place, we've never disengaged and then stopped the funding or the support to the school or the partners.
Tommy, what happens if a child doesn't have access to a breakfast program like yours? What happens to children if they can't get those breakfasts?
Well, you know, we did a survey with certain schools recently, and basically what they told us, it provides a safe and inclusive and destigmatized environment, improves mental health and well-being, mood and behavior. The attendance is on the rise, but, you know, a child that starts their day, first of all, it's a right. It's a right for every child to be able to develop their full potential, and that child is healthier. An healthier child means that later on health costs will diminish. Number two, these child are implicated. They're sensitized. These are child that are going to be implicated in their community. And number three, should it be a no-brainer to make sure, because these children are the next doctors, nurses, journalists, a plumber, electrician of tomorrow, that as a society, for all our well-being, that we make sure that they're able to develop their full potential. But every statistic shows that they have a better power of concentration, and therefore it's contributing to be more successful.
We're with Tommy Kulczyk, President and CEO of the Breakfast Club of Canada. So, Tommy, you know, with what you start off with, and you know the issues that everyone's having paying their bills, and I imagine for every nonprofit out there, they also are facing financial distress and difficulty. How do you adapt? How do you become more efficient so that you can maybe provide the same amount of services with less funds?
Well, that's a very good question. Obviously, working with our different partners in the food business to make sure of finding what's the best approach and best food that is available to diminish the costs. How can we improve the way we distribute food? I'll give you an example. When the school closed, we were the only organization that was able to go back because we had to adapt the menu, modify the menu because no volunteers were allowed. So the meals were served in class. We had the approbation from the Minister of Education, the Minister of Health, and the MAPAC to make sure. So we had to change rapidly, adapt the menus, and make sure that obviously it was able to distribute it in schools and directly in the class. So we're constantly working to try to improve and see how we can facilitate and reduce the costs. When the first thing we ask any partner when we open a new program is, how can we help you reach children? Some need equipment because they're not equipped to facilitate a breakfast. Some need just training. Some needs delivery of food or just money to buy local food. As you know, the Breakfast Club of Canada has been there for 29 years, and their expertise has been shared now all across the country. So we have partners all across the country. In Canada, it's over 3,000 program, and every morning it's over 426,000 children that are reached, and 359 of these programs are in the Indigenous communities.
And Tommy, how much does it cost to do this program? Like, do you view it on a per breakfast basis? Like, do you have the numbers on how much each breakfast ends up costing you, or how do you view that?
Well, if you give $10 to the club, that provides 5 breakfasts. So $20, 10 breakfasts. So $20 will make sure that a child has breakfast for 2 weeks. That's the average cost that we have. It varies from our area because in some area, like in the Indigenous community or farther away, sometimes the cost is a little bit more expensive because it's more expensive to get the food in that area. But an average wise, if you give $2, that will provide a meal for breakfast for a child.
So Tommy, how can we help out? How can our listeners help out the Breakfast Club of Canada?
Well, your donation to Breakfast Club of Canada will help nourish children's potential, one breakfast at a time. It's easy. You just go to our website, Breakfast Club of Canada, or you can text the word club, CLUB, at the number 20222. And in September and October, while visiting your Costco or your Walmart or your Couche-Tard, you'll be asked if you're able to contribute to the development of the children.
Tommy, thanks so much for your time this morning as we prepare for the back-to-school period. Appreciate it.
Thank you, and thank you for your time.
That's Tommy Kulczyk, President and CEO of the Breakfast Club of Canada.